The next era is the health promotion, disease prevention era. So from the mid-1980s through about 2000. And here the focus is on individual behaviors and disease detection in those vulnerable and general populations. So we have a clinical and population-oriented approach with the key focus being on prevention. So some notable events and moments in this era. The AIDS epidemic in the mid-1980s. It illustrated the need for multiple interventions to reduce risk. So not only was there the outreach to vulnerable populations in terms of education about safer sex, but there was also the research in terms of the cocktail that we now know is beneficial to individuals who have tested positive for HIV. And there's also been a reduction in coronary heart disease through multiple interventions. Which brings us to today, where we are now studying population health. And this is looking at a coordinated effort for public health. It involves the healthcare delivery system, it involves prevention, and we all share evidence-based systems thinking. With systems thinking, it's not a linear way of thinking. You need to have feedback. You need to evaluate what you're doing to ensure that it is effective. So this is what has led to our evidence-based recommendations. We look at data, we use it to evaluate, we use it to inform where we're spending our money. We focus on the harms and costs as well as the benefits of intervention. And also there's a globalization. So we have evidence-based medicine, information technology, shared databases. We now, though, have new challenges, things like antibiotic resistance and global infections, SARS, tobacco control, climate change. These are global collaborations to try to make the world's health, population health, improve. And so as our final slide, we have population health, which is a collaboration between the healthcare systems, traditional public health, and also social policy. So you can see that the healthcare system is that medical system for delivering one-on-one individual care. Traditional healthcare is group and community-based interventions, things like installing parks, making sure that there's parks, health education about proper eating techniques, what we should eat, exercise, community-based interventions. That would be considered traditional public health. But then there's also social interventions, which have secondary impacts on health. How our cities are planned. Are there parks? Are there places for people to exercise? Or are people too crammed in? Is there too dense a population in an area? Are there supermarkets where we can get healthy foods? These are social interventions and social policy, and together the collaboration creates the public health system that we have today.